Hi, I'm Ashley and I'll be performing oxygen therapy and inspection of a test tube. So I would walk in, provide privacy to my patient, ask for two identifiers, name and date of birth. Hi, I'm Ashley, I'll be your nurse this evening. I'm going to give you some oxygen therapy first. So I would wash my hands and then put clean gloves on.
And you're really you gotta get you a roll all the way in there, all the way to that first ridge. And put your little muscle.
All of these oxygen therapies would be hooked up to either wall or a oxygen machine on the floor. So this is just, I think this is just the simple face mask. And these are little things that go inside of it to count the amount of oxygen that's going through them. So this one would be 24% oxygen, and you would just simply place this over your patient's nose and mouth, and then it would be hooked up to wall air. This is another oxygen delivery system where, again, this would be connected to the wall, and you would put this over your patient's face or nose and mouth with this constantly inflated. And then for the nasal cannula, this again would be attached to wall oxygen, and then you put the little nose pieces inside the nose and wrap the other part around the ears, and then you would obviously inspect the behind the ears just for redness or discomfort, and if there was, you would put gauze or a little pad over it. And then for chest tube inspection, I would come in, introduce myself, have the two identifiers, and tell my patient that I was here to inspect his chest tube, and then I would wash my hands, put clean gloves on. So then I would look at the site of the chest tube, making sure that it's fine and not red or swollen or anything, and then I would palpate for crepitus, which is a popping noise under the skin, which means that there's carbon dioxide getting under the site of the chest tube, and that's all seems fine. And then these three sections right here are for the drainage portion of this machine, and so I would document on my shift how much drainage was on there, and I would mark it, and I'd put my name, date, and time on there. And then this is where you would want to see fluctuation of air upon inhalation and exhalation. On inhalation it would go up, and on exhalation it would go down. And then this is the chamber where you would fill it up to the amount that the machine calls for, which is usually 20, so that would always have to be filled up to 20. And then I would make sure my patient was comfortable, wasn't in any pain, and that completes my scale.